She was doing trials using BCG vaccine, 2 shots inside of 1 month with type 1 diabetes, and 3 years later, the diabetes goes away. And what's so fascinating about this story, typical to the things we talk about all the time, and that drew my attention to it, was FDA was trying to shut the trials down, and then suddenly the manufacturer of the BCG vaccine she was using shut down. They stopped making BCG vaccine, I think in the country, but certainly in the area she was living in. So she ramped up her own manufacturing plant for BCG so she could continue her trials. I mean, like really, really high rates of success. So much so that I've run into people with kids with type 1 diabetes and said, see if you get into one of these trials. I think it's really fascinating. Now, I don't know what the long-term effects are going to be, and maybe it has some other thing. But what I said to her is, all right, after she'd explained the whole thing, I said, if this works and you're giving the shots of BCG and then 3 years later, suddenly type 1 diabetes disappears, which is, I mean, that shortens your lifespan. And I thought to myself, if I had a diabetic child, I'd be thinking about that. If I had diabetes, I'd be like, I'm going to try it out. In France, they were doing similar studies with BCG and multiple sclerosis, very similarly giving
another
2
inflammatory
shots,
disease,
multiple sclerosis disappearing. So I said to her, is it possible that tuberculosis has a beneficial effect on the human body for some people? And which at that point, half of my audience had already left and stopped because I'm a shill for pharma, and they finally proved it. But she said, that's exactly what it proves.
Yeah.
Just like what we now realize, as we have overprotected ourselves, we are using like that tuberculosis, she said, is probably the most prolific bacteria on the earth. We have evolved with it. It is a part of our experience. And so now that we're putting Clorox in everything, cleaning our water, we've basically erased it. We're now having autoimmune diseases because we're not having our immune system primed by this interaction with, as you said, like this low-level infection that most people cleared.